Good morning, Facebook. Welcome to our Medicare Monday on February the 21st. We are here to recognize American Heart Month, and I am joined by our co-hostesses, Melanie Garland, and I believe Susan Spilly. There she is. So we are here again. We're going to talk about how Medicare helps keep our heart healthy and how we can get all of our preventative care taken care of with our Medicare. So Melanie, I am going to pass it on to you to talk to us about our Medicare heart health.
I was muted and I couldn't find the button. Goodness gracious. All right. It is a Monday morning. Good morning to everyone and good morning to Megan and Susan. So happy to be here today and so happy to educate our viewers on some of the wonderful coverage details of cardiovascular health and prevention and disease and all the things. So February is American Heart Month, and I went red today for our presentation to show awareness for heart disease here in our country. So we're just going to talk briefly about some of the coverages that Medicare does offer, if I can get my clicks right here. And we just want to kind of start with, why do we celebrate American Heart Month? And American Heart Month is a great opportunity to kind of focus our attention on ways to promote heart health and to maybe even maintain that heart health. So maybe you're not aware of heart healthy practices or prevention tools that could be available to you. So we hope that this presentation can help with that a little bit today. So since 1963, I wasn't around yet, but American Heart Month has been celebrated as a way to educate Americans to join the battle against heart disease. All right. So moving to our next slide, well, how does Medicare play into that? What's the Medicare coverage for heart disease prevention? Well, there is a cardiovascular disease screening that can be done for Medicare beneficiaries. And this includes tests to help detect heart disease early. So these tests can measure cholesterol levels, blood fat levels, like your lipids, and triglyceride levels. So I remember when I was a kid, my dad went to his screening for this, and that's when he went from Mountain Dew to Diet Mountain Dew. So apparently his triglycerides were a little high. I don't know why I remember that, but I do. Okay. And then how is the cardiovascular disease screening covered? Well, great news. It is covered under Medicare's Part B preventative services, which means it's no cost to you. So it's 100% fully covered, and you do not have to qualify as far as risk factors or pre-existing conditions go. It is something that no matter how healthy you are or what stages you are in your life, every 5 years Medicare will cover this screening for you. And the whole idea is to detect heart disease early. So every 5 years you can have this screening. All right. And then moving forward, another type of coverage that can help those that may have experienced a condition where they can qualify for what's called cardiac rehabilitation. So this is a comprehensive type of program that's developed for you, and it can include exercise education and counseling on good practices to try to maintain good heart health or kind of rehab from not having good heart health. So this one is provided for those that have a qualifying condition. So there's a long list of these qualifying conditions, but I went ahead and I wrote, if you had a heart attack or a heart transplant, those could be conditions that would qualify you. But it's always good to ask. It never hurts to ask. So if you think that you may qualify for cardiac rehab, ask your doctor, ask your professionals, be an advocate for your health. Absolutely. Then there are also a form of cardiac rehabilitation that is for those that may be hospitalized due to their cardiac condition or their heart disease condition. And if that's the case, then you can have that intense cardiac rehab in the hospital setting. So just always check with your doctor. You may never know that you may be able to get this type of thing, and it may help improve your condition. Okay. So what happens if you're viewing today and you're like, okay, all these preventative things are great. Thank you for this information. But what if you are currently fighting heart disease? Well, American Heart Awareness Month isn't just about the awareness of the disease and the prevention of the disease. Indiana SHIP also wants to support those that we know that are fighting the disease. So how is certain things covered if you are fighting heart disease? Well, under Part B, that's going to be your doctor's appointments, maybe your specialist with your cardiologist, your outpatient cardio rehabilitation, if you qualify for that, and ongoing tests and diagnoses as things progress or maybe improve to see what your condition is. So I don't know. I never followed up with my dad to see if his triglyceride levels went down after he switched over to that Diet Mountain Dew, but I know he doesn't drink it at all now. So maybe they went a lot lower. I don't know. But I'm sure if he went to his doctor and got a test on that, he'd be covered for that prevention. So the Part A covered services. So I always think A stands for admission. So there's so many things to remember with Medicare. So I have to have all my little tricks to the trade here. So A stands for admission. So if you are admitted into the hospital for your heart condition, you will be covered under your Part A service. Okay. And then the Part D, so D, that's an easy one. D stands for drugs, right? So any prescription medications that you have been prescribed by your doctor, your cardiologist, or who is treating you for that heart disease to treat, prevent, or manage your condition. You always want to make sure that the Part D plan that you have chosen covers that medication. And a good practice is if you're expecting a new medicine or to switch, or you're having that conversation with your doctor, bring in your prescription drug plan, whether it's through the Advantage plan or the standalone drug plan. Bring that formulary booklet in with you and discuss that with your doctor so that you can make sure you're on a medicine that's covered by your plan. All right. And then if you have more questions after hearing today's presentation and you need more of a one-on-one counseling, remember, that's what we're here for. We've got volunteers all throughout the state, sites all throughout the state, and we're ready and equipped to help you. So we can do that with individualized counseling sessions. We can do that over the phone, in person. We can meet with you right here on Zoom, not Facebook Live, on Zoom. And we have a SHIP helpline that can provide assistance with where your local SHIP counselor is. And that same SHIP helpline, those ladies that work in there can send out reference materials and general information to you on different things that you may request. So you can always contact us, and this next slide should tell you how you can get a hold of us. So you can call that number on your screen. You can visit us online, or you can follow us on social media. So if you're looking at us today, you probably are following us on social media, but we're also on Twitter, LinkedIn, and YouTube. So if you have any questions, go ahead and comment those in the chat. And then remember that these videos are saved. So if you're viewing today and you may think of someone that could really benefit from this presentation, know that we save these to our Facebook page so they can always catch us at a later time as well. All right, girls. Well, it's President's Day.
It is.
It is. And before we move on to the fun quiz, I'd just like to give a shout out to our coworkers in the call center and let folks know that one of those items that they can mail you that Melanie referenced is a whole booklet on preventive services that Medicare covers. And we also have a brand new updated brochure, and it covers the COVID stuff. So it's really up to the minute information, and we can send that out to you. Also, just for folks who are struggling a bit financially, just remember that there are Medicare programs that can help you cover those costs, like over Melanie's shoulder. If you need help with your Medicare costs, please just give us a buzz. We can talk to you about those programs and even help with applications if you want.
Yes, absolutely. Okay. Well, I heard that Susan put together a special presidential trivia. So I don't know if you ladies know this, but I'm from Abraham Lincoln's boyhood hometown. And my sister works for the Visitors Bureau, and she had shared with me an Abraham beard filter the other day. And I'm sad to announce that I forgot to put it on for our trivia, but I'll just let you guys use your imaginations for that. So, but
Did
I'm
it have the
excited.
hat, Melanie, too?
Oh yeah, girl. Oh yeah.
That
I
would have
know.
been awesome. Mm-hmm.
I know.
Well,
I really-
next year you can do that.
Yes. So tune in, guys. 1 year from now, we'll be back. Maybe
We'll be bearded.
All right. So we're teasing and joking, but we're really excited to do a presidential trivia with you today and give a shout out to the presidents that have made Medicare what it is today. So let's get that going. And I guess that's my cue to pull it up, huh?
Yeah.
Yep.
And so certainly the presidential trivia game has a theme, which of course is Medicare. So these are all Medicare related. So let's go ahead and get started with our first question. All right. Who was the president who signed Medicare into law? So which president signed that Medicare bill into law? Melanie and Megan, do you know the answers?
I know. Megan.
I know, too.
How about these gals that are participating in our Facebook Live this morning? We have several.
I've got some good mornings, but I haven't gotten any questions yet. So
Okay.
I think we'll showcase the answer. What do you guys think?
All right, let's go for it.
All right, Megan, ready? 3, 2, 1. Lyndon B. Johnson.
In 1965. Were you born in 1965, Melanie? No.
I was not, but I was born in July. So I feel like
There
I'm
you
in
go.
good company.
Okay, good old LBJ signed a lot of things into law, and the Medicare Act was one of them. All right, next question.
Okay.
Who first called for a national health insurance fund? Now, sometimes I think we think of Obamacare as the first attempt, or really Hillary Clinton's plan as the first attempt at national health care beyond Medicare. But a few years ago, a president called for health insurance fund.
Okay.
Got a guess?
Ladies, Wendy Masters answered our first question. So, Wendy, we will mark that down, because if you, like Wendy, are watching and want to answer, you may be eligible for a wonderful ship-themed prize.
Right. And I would just venture to say, if you answer a question, we're going to send you a prize if you give us your direct messaged address.
Susan's nicer than me. Okay. So who knows the answer here? I'm checking our chat.
Ooh,
Oh.
Wendy chatted in.
That's right. She says FDR or Truman.
Okay, well, let's see who it is. Megan, what do you
And
think?
Truman. It's Harry S. Truman.
yay.
Yay.
And for the
Oh, wait.
record, I was not around in 1945.
Did you want to talk about 65?
I was definitely around in 65.
Oh, okay. Okay. Just learning so much today. All right.
Okay, next question. Which president signed the law that expanded Medicare to include folks under 65? So we know that people under 65 can get Medicare if they have Social Security disability for 2 years, or they have been diagnosed with end-stage renal disease. And both of those were in that law expansion. So who was it?
Let's
We should
check
have the Jeopardy music. Do, 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 do.
do.
It
Oh.
wasn't FDR or Truman. We know that.
It wasn't Lyndon B. Johnson.
No. Close.
All right. I don't see any. Oh, I'm sure Eleanor mentioned it first.
Oh, yeah. Absolutely.
Go, Wendy.
I'm a big Eleanor fan too, Wendy.
Mhm.
All right, guys.
Okay, I'll give you a hint.
Okay.
I am not a crook. I am not a crook. Come on, you guys. You know, don't you?
Nixon.
Yeah.
Nixon.
Nixon. Actually, I did not know this prior until I was reviewing this, and I was very surprised by the answer.
I only remembered it because it's in our Medicare bingo. But other than that, I wouldn't have known it.
Oh. And in 1972, that was an interesting time. Oh, Janine Haggerty Adkins guessed Nixon. Very good,
Yes.
Janine.
And she's showing her badge. She is one of our top fans. Thank you, Janine.
Ooh.
We love us some Janine. All right, how about the next question? Which president proposed adding unlimited hospital days, a limit on out-of-pocket expenses, and expanded nursing home coverage? We like that president. Well, we like this anyway. So who proposed adding all that stuff? Anybody have a guess? We know it had to be after Medicare was started.
Mm-hmm.
Wendy is guessing Reagan.
Mhm.
Let's see if her guess is accurate.
All right, here we go. Ronald Reagan via the Medicare Catastrophic Coverage Act in 1988. You know who was born in 1988, girls?
You?
Me.
Yay!
Yay.
Along with the Medicare Catastrophic Coverage Act.
Yes, it was. Yes, it was. Okay. So, however, when upper income beneficiaries complained about having to finance the new benefits, many of which they already received via retirement plans, Congress repealed most of the act in 1989. Okay, you never know what you may learn on Medicare Monday, guys.
Yeah.
Next question.
All right. Which president first requested a study of including prescription drugs in Medicare? Who kicked that off? Who do you suppose that would be? Medicare had to be in existence, right?
George W. Bush.
W? Let's see.
Oh, no. I was wrong. Okay, LBJ requested the study, and then in 1969, the task force, I like that name, made the recommendation to add drugs to the Medicare benefit package.
But you know, that is really weird because 69 is a long time from when Part D finally came into being.
Thank you.
A
That's
very
why I was
long time. Yeah.
That's why I got that one wrong. So it was just a study then.
Yes, and a task
Wendy
force
was with me.
recommendation.
Wendy said
Oh,
Clinton.
Wendy guessed Clinton.
We were in the same
Mhm.
kind of
Thought
area.
process. Yeah, that was kind of a trick question. And honestly, when I was doing my research to write this quiz, I was really surprised that people were thinking about prescription drugs back then, because
Mhm.
you know, back then things were not as they are now on many levels. And the prescription drugs were, first of all, there weren't as many prescription drugs to fight illnesses. but people were generally able to afford them. So I don't know, I was really surprised at this. And by the way, the sources for most of these slides came from the CMS website.
Perfect.
Okay, next question.
I got it up there.
Which
Sorry.
president signed the Medicare Prescription Drug Improvement and Modernization Act, which added an optional drug benefit? So who signed this in, which actually added the drug benefit as a package to Medicare? Wendy says no idea. You were close when you said Clinton, but Wendy.
Is this one Burse?
How about Sean? Sean's following us.
Yeah, I see Laura Lee is on here. We've got Kim Goodridge is watching. Not to call you
Hi,
guys.
Kim. Look forward to meeting you. We're talking with you soon.
Let's see.
Okay, Megan, read us the answer there.
All right, and the answer is, drum roll please, George W. Burse. He signed the act into law in 2003. Polls taken that week reflected that 47% of seniors opposed the changes and 26% approved. 56% of the general public who said they closely followed the changes said they disapproved of the legislation, and this was from the Washington Post ABC News poll.
So isn't that pretty darn shocking? So Medicare beneficiaries were seeing prescription drug coverage coming down the pike, yet 47% of them opposed the change. I just found that shocking. So that's why I added it in there.
Yeah, that's very interesting.
And just 56% of the general public said that they disapproved. So we're glad that the Congress just ignored all those polls and went ahead and said yes to prescription drug coverage to Medicare.
Absolutely. Well, Susan, you've been asking the questions, but I'm going to put you on the spot. Wendy says, when did Part D come in?
You know this one, 2006.
Yay, I knew you would know that one.
For those of us who were in the biz in 2006, it was a landmark watershed big time thing, because if you think of all the Medicare beneficiaries living in 2006, all those people needed a prescription drug benefit or were at least allowed to pick one up. And so SHIP counselors back then and other people who worked with older adults as a professional, we all helped folks look at the drug plans. And back then, it was all looking at them on paper. Okay, next question. Which president was the first recipient of a Medicare card? So if you think back to what we talked about who was the president when the legislation was enacted, who do you suppose was there to get the first card? Not Obama, but I think that was an answer to another one.
We do have about a 20-second delay. So just keeping that in mind, guys. So sorry if we're moving forward a little bit here.
Yeah.
Okay, Megan, what do you think?
I think it's Truman.
Ooh. Bonus, extra credit. Who gave it to him?
That I don't know.
You're right, Megan. Harry Truman was at the bill signing ceremony when LBJ presented him with his card. So I think I heard somewhere, but I didn't find it, that Harry Truman's wife was with her and she got hers too.
Aw.
Oh, nice.
That might be me not remembering right, but I think I read that somewhere.
It's a cute story, so we'll go with it.
Yeah.
Nothing more romantic.
Mhm.
Getting your Medicare cards together. Of course, that doesn't always happen unless you and your spouse turn 65 on the same month.
Exactly.
That's right. That's right.
Yes, Janine guessed Truman too. And Wendy
Yes.
says, thank you, Papa Bush. And the Congress at the time. The Congress, got the legislation through, and the president is the one that either signs it or vetoes it. So in this case, he signed it in. So yay, rah. And we are all better for it, I think.
Absolutely. Well, thank you for playing. Thank you for commenting. We had so much fun reading your
Mhm.
comments and seeing you guys try. I got stumped at least once. First time that's ever happened. And then thank you, Susan, for putting that together for us. That was very fun and festive. And we hope everyone has a wonderful President's Day today, whatever that means for you, however you're acknowledging that and celebrating that in your life. We hope that it's wonderful. So
Yeah.
they've done a lot of great things, and we got to see a small tidbit of that today. So that was great. All right. Okay, Megan. So what do we got going on?
Well, next week we are going to be here and we are going to be celebrating Black History Month. So join us on February the 28th as we present on Black History Month and talk about this month and Black History Month.
Yeah. Same time, same place.
Yep.
Same saved page. So if you can't watch live, you can always come back and see us at a later time. And I think that's it, ladies. Did you have anything else to add today?
Yeah, I would just say direct message us with your address and we will get those prizes sent out this week. So be watching in your mail.
To anyone that participated, we've got prizes and we want to give them out. So if you participated today, please send Indiana Ship a direct message and we'll get that out to you.
Yeah.
All right.
Thank you.
Okay, guys. Well, have a great rest of your day, everyone, and a great week.
Yep.
All right. We'll catch you next time. Bye.